Hey guys, this is Chris Dewey with May River Medicare. And most of you know that I'm a huge proponent of original Medicare versus a Medicare Advantage plan. I prefer helping folks secure a Medicare supplement where they can go anywhere in the United States over an Advantage plan that's got a restrictive network. However, there are situations where I would have to say a Medicare Advantage plan is a better fit for certain individuals than a Medicare supplement. And the big takeaway from this is if you look on this screen, if you're on a low fixed income, what do I mean by low fixed income? Because we're in Beaufort County, so that could be 3,000, 4,000, some people might consider low. I'm not talking about that. I'm talking about folks that are making less than $1,900 a month, all right? So if you're an individual and you make less than 1,843, let's say you're in the 1,800 to 1,900 range, you definitely want to apply for what's called extra help for your Medicare Part D drug plan or the Advantage plan drug portion of it, because what happens is you apply for extra help, which takes 2 seconds. Our internal staff does that for all of our clients, especially are disabled under 65 on Medicare. If you're in that 1,843 range or the 2,500 as a couple, you're below 2,500. Technically, it's 2,485 a month. But if you're below that, apply for extra help, because what's going to happen, you'll never have a premium or a deductible for your drug plan. If you have a premium for the Advantage plan, it'll pay all or most of that, as well as any kind of drug deductible. And this year, there are many Medicare Advantage plans that if you have any level of extra help, whether it's 50%, 75%, 100%, 25% extra help, there are some Advantage plans that will pay all your drugs so you don't have a copay for brand name or generic drugs whatsoever, all right? So had a couple. They've been my supplement clients now for 6 years. They're on a low fixed income, all right? And the wife makes right around $1,300 a month. Husband makes about $1,800 a month. Well, I'd say even less than that, more like $1,700. They're each paying $150 a month for their Medicare supplement. So what does that come out to? They are paying $3,600 a year in premium. And she makes $1,300, he makes about $1,700 a month. So they're paying $3,600 in premium. And it's to the point now where it's just not doable with the price of groceries skyrocketing, with rent being so expensive in Beaufort County, now it's seeping into Jasper County. It's just not doable for them. So what are we going to do? We're going to do the next best thing. We're going to find them an Advantage plan that's going to enable them to continue to see the doctors they see and they're going to continue to get their extra help. We applied for that. They both get that. So we want to find a plan that's going to save them money. So this is Beaufort County. Now, most agents that haven't really been around the block too much are going to look for what's the lowest monthly premium. And let's get some dental and vision. We can sell them on the cherry on top things like free transportation, free dental. Guys, you don't want to do that. If you're accustomed to a Medicare supplement, the name of the game is MOOP, or maximum out of pocket. So we want to find the plan with the lowest maximum out of pocket. It's got a good star rating. It's got their doctors and drugs in the provider list and on the drug formulary. So if you look, let's go to the highest maximum out of pocket. So Humana's got a bunch of plans, $8,850, $8,300 max out of pocket. What does maximum out of pocket mean? That means if you get sick and you're in and out of the hospital's got a copay with Advantage plans. That copay can range from $195 all the way up to $450 a day. Typically, you're looking at a $300 a day copay for days 1 through 5 or 1 through 7. You leave the hospital for 60 days, you go back in the hospital. That starts all over again. You got to pay that over again. All right, the other way that the maximum out of pocket. So if you ever spent $8,300 with this Molina plan here, you don't have to pay anything for the rest of the year. So the way you're going to hit that is a lot of hospital visits, outpatient visits, cancer. You have to pay 20% with all Advantage plans. You got to pay 20% of chemo, of radiation treatment, The other thing you have to pay for if you're on any type of a drug like Dupixent or Skyrizi, things for skin conditions, or Humira. Actually, that would fall under Part D, but there are many injectables, Part B injectables, that's not covered under Part D drug or this Advantage Plan drug portion of your plan. It's actually covered under Part B. Those are the drugs you have to go to the doctors once a month and get a shot, okay? Or once a week, or whatever it is, once every 2 weeks. You have to pay 20% of whatever the price of that drug is. And for drugs like Dupixent, for drugs like Skyrizi, $15,000 a shot a month drugs, you're gonna hit your maximum out of pocket very, very quickly. Okay, guys, in conclusion, if you're spending 25-30% of your income on Medicare Part B premiums and combined with your Medicare supplement premium, it's not feasible. We need to look at an Advantage plan. The A has a low maximum out of pocket. We're going to get the lowest max out of pocket we can get. That's your worst case scenario. Make sure your doctors are in network. Make sure your drugs are on the formulary, all right? So for Beaufort County, $3,450 is the lowest max out of pocket, but it's less. It's 50% less than most of the Advantage plans in Beaufort County. Most of the Advantage plans are $8,800, $7,500 max out of pocket, usually right in that $7,500 range. Humana's $3,450. All right. United Healthcare's got one for $4,500. So what we got to look at too is with this low maximum out of pocket, there's also a medical deductible. And that medical deductible doesn't apply to things like doctor's visits or specialist visits or emergency room or urgent care or chemo or radiation or diagnostic things like colonoscopy, mammogram, preventative obviously doesn't count towards that, lab services. So where would you spend that $750 if you go to the hospital? All right, they're going to tag that on. They're going to outpatient surgery. You'll have a deductible there. All right, but again, we like this plan because it's $3,450. What about this plan? Zero copay in or out of network for primary care, $5 for specialist, diagnostic colonoscopy. If it's done at a surgical center, let's say they do a colonoscopy, they find a polyp, that's zero if it's done at an ambulatory center. So that's excellent. All your preventative is free with these plans. So what do I mean by that? Your wellness visits, your cardiovascular screenings, your bone mass, your mammograms, things like that. Glaucoma screening, diabetic screening, depression screening, prostate cancer screening, lung cancer screening. All right, so that's all zero. All right. Other thing too, emergency room 135. You get an MRI done at the freestanding radiology center or physicians or specialist visit. $200 for MRI, PET scan, CT scan. That is very good. If you compare it to the other Advantage plans, guys, that's excellent. All right. So if we keep going, I'm not going to go too far into this, but everything's got a copay. All right. Guys, the smaller the facility, the less you pay. You get your x-rays done at the doctor specialist office, zero, $5 there. If you get it done at a hospital, it's going to cost you more. If it's done at a freestanding radiological facility, $50 copay. All right. Mammograms, if you get it done at the doctor's office, zero, specialist $5. Lab services are all zero if it's done at a freestanding lab like Quest Diagnostics or LabCorp. If it's done at the doctor's office, you pay nothing. All right. All right, so let's keep going. Sleep study, zero at the doctor's, zero at the member's home, $5 at the specialist. You guys get the picture. All right. Now these Medicare Advantage plans are going to give you extra benefits. $999 towards hearing aid. They're going to give you $500 towards whatever you want as far as dental goes. So that's nice. Vision, they're going to give you. Let's see here. So vision, they're going to give you $150 max benefit. That's for eyeglasses, frames, contact lenses. They're going to give you $75 towards a routine eye exam. So you get some extra stuff as well. All right. Physical therapy, $25 a pop. Emergency ambulance, $300, whether it's copay, whether it's a airlift or whatever, regular ambulance. All right. Allergy shots, 0. Chemo, again, that's why we want a low max out of pocket. You get cancer, you got to pay 20% of all your chemo, all your Part B injectables. All right. Now, the nice thing about this is with prescription drugs, insulin, they changed the law, $35 copay for any type of insulin, no copay for shingle shots, no copay for flu, COVID. It's 0 for vaccines, guys, which is fantastic. All right. So, drug costs. Your drug plan is built into the Advantage plan, so it's all in one. So your drug plan is included. Tier 1 and Tier 2 drugs with Humana, if you go to CVS, Publix, Kroger's, their preferred pharmacies, you're going to pay 0 for Tier 1 and Tier 2 drugs. Again, if you have extra help, apply for it. If you're right around 1,900, 1,800 or less, you definitely want to apply for extra help, because a drug like Eliquis that's $47 for a copay is only going to cost you $11. All right, same with these non-preferred drugs, and you want to check your drugs on the formulary. But again, if you look over at this screen, if you get extra help, regardless of the level, $11.20 for the most expensive brand name out there, $0 to $4.50 for generics. A lot of these Advantage plans will pay, if you're on extra help, they'll pay all your drugs. You don't pay anything. There's another option that you could do besides seeking out the lowest maximum out of pocket. You could get what's called a give back plan. And these give back plans, what they do, if you look right here, this is a Humana 0 premium plan. This is a Humana 0 premium plan. They're going to pay $100 of the Part B premium. Remember I told you the Part B monthly Medicare premium that everybody has to pay, almost everybody, I'll get into that in a second, is $174. This is going to pay 100 of the 174, so they're only going to take out $74 a month out of your check, so you get an extra 100. What we want to do with that $100, we want to get an indemnity plan. So if you look here, you have an $88,700 max out of pocket. How would we ever get to that? Well, I told you before, hospital. So we customize this. Your hospital is $298 for days 1 through 8. What I recommend we do is do $300 for days 1 through 6. Very rarely are you in the hospital more than 3 days. That'll more than cover your hospital bill. Okay. The other thing is, as I said before, chemotherapy, radiation, any kind of cancer treatment, you're going to pay 20% of the cost. So that could add up to your $8,700 max out of pocket very, very quickly. Like I said, $8,700. So what we're going to do is we're going to get a $10,000 cancer plan. What does that do? Well, you get cancer, you're going to have to pay 20% of radiation, chemo, any kind of injectables that they might give you that's related to cancer. So you're going to hit that $8,700 max out of pocket. But what this is going to do on the first sign of cancer, it's going to cut you a check for $10,000. All right. Now, if you had cancer in the last couple of years, there's going to be a 6-month waiting period. So after 6 months, it'll pay. With the, I would recommend a hospital lump sum of $500, because like I said before, with this give back plan that gives you $100, there's a $500 deductible. It's going to go through either outpatient surgery or it's going to go towards the hospital. All right, that's where or MRIs too, MRIs, CAT scans, things of that nature. So what we're going to do, we're going to cover our downside. You get cancer, you're not going to pay $8,700 max out of pocket because you're getting a check for $10,000. The other thing where you could get hurt, like I said, hospital, it's going to pay $300 a day for days 1 through 6. All right. This is $298 for days 1 through 8, but we don't need 8 days. If you want 8 days, we could do it just for peace of mind. So you're covered 100%. Now you go back out of the hospital for 60 days, you go back in, this thing kicks in again. $300 a day for days 1 through 8. Again, I think we should just go with 6 days. Very rare you're in the hospital that long. Also, outpatient surgery indemnity rider. If you look here, let's go down a little bit more. All right, Surgery services. Most outpatient surgeries are either done at a surgical center or even the doctor's office with dermatologists and things like that. So you got to pay a $410 surgery copay. This baby's going to pay that for you. So, okay, so how much does all this cost? You're never going to have a hospital bill. It's going to pay that $298 for days 1 through 6, all right? If you get cancer, red flag number 2. Cancer is a good way to hit your max out of pocket. It's going to pay $10,000 if you get cancer. Your max out of pocket's only $8,700. So it's going to pay your cancer. It's going to pay your hospital. It's going to pay that hospital deductible of $500. So we're going to take $64 of the $100 that Humana gives us. We're never going to have a big bill. Cancer paid for, hospital paid for, outpatient surgery paid for, the hospital deductible paid for. All right, so we don't worry about it, and we still have $30-something. We still have enough to get a dental plan if we want to add a dental plan. Humana's got a great dental plan for $32. You can get a fantastic dental plan, $2,000 in upfront dental. So we're basically taking the $100 that Humana gives us, we're peeling off $64 to pay the hospital bills, the cancer bills, the outpatient surgery, the lump sum that they charge you, the $500. That's all going to be paid for. So what you need to understand real quick, this plan, there's no underwriting. For someone 60 to 79, you automatically get this policy issued. Let's say you've had cancer over the last year or two. There will be a 6-month pre-existing clause in effect, which means any condition, illness, chronic disease will not be covered for claims for the first 6 months. After that 6 months, you're good to go. Premiums are not changing. All right? So the other thing, too, I want you to understand, okay, this is built without the riders that we added for the $64. We added some riders. Let me tell you what this plan comes with. So we already got the $300 for days 1 through 6. All right, observation unit. This is included for free. What's the observation unit? If you go to the hospital and they don't admit you, and let's say you have chest pains, you go in there and you, while you're there, they don't admit you, but they put you in a hospital bed. You could be there for 48 hours and they don't consider that a daily inpatient, hospital inpatient. You would be considered, all the stuff that you get done would fall under Part B. So let's say you have chest pains. You go into the hospital. They don't admit you. They just observe you. And while observing you, they do an MRI. They realize, oh, you need a stent put in. They do the stent surgery. Again, you're not admitted. They get that done. They let you go, let's say in 30 hours, 48 hours. All those costs fall under Part B. Okay? So this pays 6 days a year. It pays all those observation units. Big problem. People think, oh, I'm going to have it. It's just going to be my hospital copay. If they don't admit you, all that different things that they do, medicines that fall under Part D, MRIs, X-rays that fall under Part B, stent surgery even that they could do, and they don't admit you, and then they let you go after 8 or 9 hours. That all falls under Part B. It's all paid for. All right, emergency room. They're going to give you $150 per day for emergency room, maximum 4 days per year. So you got that. Believe the emergency room copay is $300. They're going to pay $150 of that 4 times a year. All right. They're also going to pay for transportation and lodging. Pays $100 per day, maximum 10 days per year. All right. Inpatient mental health. Let's say your meds aren't working. You need to get readjusted. What are they going to do? They're going to pay $175 per day, maximum of 7 days per year. All right? Now, as I said before, okay, so let's just keep going. Optional riders. So the riders that we're going to do, we don't need the ambulance rider. We don't need that. Waste of money. Skilled nursing, we don't need that. What we need, we don't need this. We're just getting the bare bones minimum. We're getting a $10,000 cancer policy. We're getting outpatient surgery, and you get 2 of those per year. We're going to get $500 because the outpatient copay is $410. Urgent care, we don't need it. Lump sum hospital, we're going to go with a $500 because there is a $500 hospital deductible. It could also be towards outpatient surgery, but we already have that covered. All right. So, okay, guys, remember, how much is this going to cost? Actually, it's not going to cost you a dime. If we go with the Humana Give Back plan, they're paying you $100 a month towards your Part B Medicare premium. So they're not taking out $174, they're only taking out $74. So all we're doing is we're robbing Peter to pay Paul. And what we're doing is, I already told you, for a 72-year-old female, it's going to be $64. For a 74-year-old male that wants all their hospital bills paid for, if they get cancer, they get a $10,000 check, which covers the $8,700 max out of pocket. Because how are you going to get to that max out of pocket? You're in and out of the hospital, you get cancer, you got this lump sum $500 deductible, that's covered, and you got your outpatient surgery covered. You got, remember I told you, the hospital observation. You go into the hospital, but they don't admit you. But they tag on a bunch of other charges that actually fall under Part B. They cover 6 days worth of observation costs a year. They're going to cover your cancer. They're going to cover your hospital. They're going to cover your outpatient surgery. Now, why did I go with $500 for outpatient surgery? Because with the Humana Give Back plan, the surgery is $410. So it's going to more than pay for 2 outpatient surgeries. It's going to pay, anytime you go to the hospital, it's going to pay $300. Your copay is only $298. Cancer's covered. All the major things are covered. And the true beauty of this program is you're not paying. Humana's paying for you. So you got a Medicare Advantage plan on steroids where you don't worry about a big bill. Guys, give us a call at 843-227-6725. We would love to help you. We can customize a plan, and you still got a little bit of money left over. If you want to buy a dental plan, we have some money left over to do that as well. All right, you guys have a great day. Bye-bye.